Hello, my name is Folashade Hadewale. Today I am going to be working on a patient, a 5-year-old, and I'm going to be conducting an assessment on the patient. We're going to be conducting physical assessment, and this patient is 18 months old. We know that there's limitation to what this patient can say and what this patient can answer according to the questions that will be asked from this patient. And we're also going to be treating another patient for an 8-year-old. So we're going to be doing the comparison of patients studying on both 18-month-old and 8-year-old patient. So I'm going to walk in now. I have my patient. My patient is 18 months old, and I'm going to conduct an assessment on this patient now. Hello. Hi, how are you doing? And my patient is able to answer all these slow questions. I'm Nurse Fola, and I'm going to be conducting an assessment on you today. Can you tell me your name? And my patient is able to answer by telling me that the name is Brittany. So my patient is Brittany. I'm going to check my patient's band, and my patient is actually here with the father. Hi, can you please tell me the relationship between you and this patient?
That's my daughter,
What's her name?
Cretin Lungs.
And I'm going to check the father's band, and I see that it matches Brittany's. Hi, what brings you here today, Brittany? Well, Brittany is not able to, it's just with the face, I could tell that Brittany is in pain. So I'm going to use a face scale to see that Brittany is in pain. It's not able to answer me a lot. How are you doing? Okay, Brittany, I'm going to listen to your lungs. Can you hold this for me and put it on your chest? Okay. So Brittany is holding the stethoscope. Here, let's do this. And with Brittany's hand, I am going to check Brittany's heart sounds. Hey Brittany, how is that? See, you're breathing fine. This is really awesome. You're doing really good. Your hair is so cute, Brittany, and with that, Brittany is already smiling. I have a stuffed animal here, Brittany. Here, this is for you. You like this? And Brittany is already smiling and say yes. You can hold this. And Brittany is holding the teddy bear that I just gave. Brittany is very happy at this moment because Brittany is just 18 months old, and this is really appropriate for Brittany's age. Brittany, can I check your hair? And I'm checking the hair. Brittany is having a coast hair. Brittany, fine here. Brittany is not having any problem with that. Brittany, can I check your eyes? Here, open your eyes for me, Brittany. Brittany is able to open her eyes for me, and I can shine light into Brittany's eyes. Brittany, can you open your mouth for me? Brittany is able to open the mouth, and I can shine light into the mouth to look at the back of the tongue. Brittany, can I put her? I'm going to put a blood pressure cuff in your arm. It's going to feel a little tightening, but it's really fun, okay? Do you want to touch it and feel it? You can touch it and feel it, okay? And I gave Brittany the temperature to feel it. So I'm going to put this at your upper arm, okay? And I'm going to inflate it. And with that, I am able to check Brittany's blood pressure. I'm also going to put this in your finger. Can you check it, Brittany? So I'm going to put this pulse oximeter in your finger. You will feel no pain, okay? With this, Brittany's still very okay with all these small questions and small talking that I'm doing to Brittany. Brittany told me, how are you feeling? Are you okay? And say yes. Brittany could also say yes that she's feeling okay at this time. And with the pulse oximeter, I'm able to check. With Brittany, I can just say, Brittany, can you just sit quietly? Okay? Don't worry, there's no problem. I just want to assess your respirations. Brittany really doesn't understand what is meant by respirations, and all she could just do is just sit straight and watch the parent at this time. So with that, I am able to count Brittany's respirations. And I say that Brittany, there I listen to Brittany's lungs together. There are no crackles. The lung sounds are clear bilaterally. And I could also count the respirations with Brittany playing with the toy that I gave to Brittany. And with the help of the patient, I mean the father at this time. Brittany feels very comfortable. Brittany, are you in any pain? Do you have any pain anywhere? And Brittany could say, yes. Where do you feel the pain? Actually, Brittany could just touch the tummy at this moment. Okay, is it okay if I just assess your tummy? Look, I'm going to also use this. You can help me by placing this in your tummy, okay? And Brittany could say yes at this time. And here, touch it, and we could do it together. It's really fun. So by that, I am able to do the assessment with Brittany. How do you feel? That's really nice. So with the help of Brittany at this time, I am able to complete all this assessment with her help while she smiles without showing any discomfort, because this is also still very appropriate to Brittany's age. I could also go further to try and see, do a little bit of neurologic assessment on Brittany to see if this is, I mean, to see the appropriate development for Brittany. Brittany, are you in school? And Brittany can say a little bit of yes, school. But I couldn't ask a lot of questions pertaining. What did you eat today? Did you? Brittany cannot answer because she could not remember what she actually ate today. But Brittany knew. Did you eat today? Yes. So Brittany could answer that she already ate today. But she can't remember if I said, did you eat rice or did you eat oatmeal or anything? Because Brittany couldn't do a lot of that. Well, that completes the assessment for an 18-month-old baby. Now I'm going to do an assessment for an 8-year-old baby, and we can see the difference between an 18-month-old baby and a 5-year-old toddler at this moment. So I am also going to just do like I just walk in. Hello, good morning. How are you doing? I am Nurse Fola and I'm going to be assisting you today. Can you tell me your name and date of birth? Of course, an 8-year-old could verbalize the name and date of birth at the same time. Oh, okay. And an 8-year-old is here with the parent as well. I am going to check the name band as well, even though the 8-year-old also tell me his name, because I want to be sure that he's neurologically okay, and I'm also checking the father. I'm also going to ask the parent, what is your relationship to this patient? And the parent is able to confirm that this is my daughter. Okay, now it's telling me your name is Brittany. How are you feeling today? An 8-year-old is able to tell me how he's feeling today. And he's able to tell me the date of birth as well. And I'm going to ask, are you in any pain? An 8-year-old is also able to tell me, yes, I am in pain. Can you tell me the location of your pain? An 8-year-old is able to tell me the location of the pain. I have pain in my tummy. And I can ask, what does this pain feel like? And on the numerical rate of 0 to 10, can you tell me where 0 is no pain and 10 is very painful? So can you rate your pain? An 8-year-old is able to rate his pain or her pain for me at this time. And I can also just verbalize by saying, can I do some assessment on you to know more about your pain? And he say yes. So with that, I can just go and listen to an 8-year-old accents and the lungs without having so much problem of giving an 8-year-old a toy or say hold it for me. And I can also say an 8-year-old, can you open your eyes for me while I use the pen light to check the eyes. And I could say an 8-year-old, can you open your mouth for me so I can put the temperature under your tongue. And I could also check that. And I could say, open your mouth wide, while I view under the tongue as well. And I could also say, I'm going to put her blood pressure cuff onto your hands. It's going to feel tightening, but you have no problem. So I am able to put the blood temperature cuff, and I'm also going to just verbalize to an 8-year-old that I'm going to put a pulse oximeter on your finger to access your and he said, oh yes, to access your pulse. And I'm also going to say, well, I don't really need to verbalize to an 8-year-old that I'm going to listen to an 8-year-old's respirations, because an 8-year-old is able to contradict his breathing at this time. So I'm just going to say, can you just sit quietly for me while I listen to your lungs? And by the time I do the listening to the lungs, I can also count the respirations for an 8-year-old at this time. I can do every other assessment by verbalizing to an 8-year-old what I am actually going to do at this time. And I'm going to ask an 8-year-old, how old are you now? An 8-year-old is able to verbalize the age. And I'm also going to say, what is your date of birth? What did you do for your last birthday? And what is your plan for your next birthday? I can also ask an 8-year-old, how is school? How are you doing in school? What is your best subject? I can also verbalize for an 8-year-old. How long have you been feeling this pain? Well, an 8-year-old might not be able to tell me typically the kind of medication he's taking sometimes, and he could also be able to tell me if he's also very used to this medication, if the parent also gave an 8-year-old a lot of education about the medication that an 8-year-old is taking. But I can also verbalize to an 8-year-old and do some medication education for an 8-year-old and say, this is how you are going to use your medication, and your parents will also talk to you about this. I can also ask an 8-year-old about if they bring their iPad, if they bring their homework assignment, if they want to do their homework assignment here, what do they like to do for fun? What do they have a lot of friends? I can do a whole lot of that with an 8-year-old because it's appropriate for their age. An 8-year-old can tell you how much they enjoy their play and how much they do with their friends and how much they enjoy going to school and what they do and how much they like their room, their best color. What color do you like? Oh, your hair is so pretty. Who made your hair? And he said, oh, I made it myself. You see, an 8-year-old is able to do all of this compared to an 18-month-old baby. An 18-month-old baby cannot do most of all of this. So this completes our assessment. You have seen the difference between an 18-month-old baby and an 8-year-old baby. An 18-month-old baby has little that they can answer or say for themselves. The parent is typically very involved, like 80 to 90% in an 18-month-old baby compared to an 8-year-old baby. An 8-year-old baby, toddler, the parents could be like 50% involved in asking for family history and some other questions that you want to ask them. And this completes my assessment. And thank you for watching.